Hello, my name is Elisa Lopez, and I'll be doing a presentation on depression and Latinos. A quick overview over depression. So, depression affects over 2 million Americans and is a serious medical illness. Depression affects the brain and affects people between, usually the onset is 15 and up. The average being around 32 years old. Depression is also most common in women, affecting about 70%. So some symptoms of depression is sadness, loss of interest in activities that you used to enjoy, loss or weight gain, energy loss, change in sleep habits, thoughts of death or suicide, and feelings of worthlessness. Depression is often diagnosed through a series of questions, a physical checkup performed by a doctor or nurse. Doctors have to rule out several other causes or sometimes pinpoint a possible reason for the depression. This may include a series of tests as well as some blood work. From here, they would refer the patient to a mental health professional. Depression can be treated through therapy, antidepressants, or a combination of both. So a general overview, depression affects approximately 9% of 9 to 17-year-olds. About 6.7% of adults experience major depressive disorder. African Americans are about 40% less likely to experience depression than their Caucasian counterparts. The Latino population in the United States is becoming one of the largest minority groups. This not only means that the nation's makeup is changing, but that as professionals, we should make an effort to learn more about this population in order to better serve them. According to the U.S. Census Bureau, Latinos are estimated to make up 30% of the nation's population by 2050. In 2011 alone, Latinos represented about 56% of the nation's population, according to the Pew Research Center. So rates of depression among Puerto Ricans is about 22.7% and 14.5% for Mexicans. So the research that I was able to find was very limited in that some populations from different South America countries were excluded. So most of the data is on Puerto Ricans and Mexicans. So that just goes to show that there's more research has to be done. For Latinos, it was found that about 9.6% suffer from long-term depression and about 4.3% suffer from 12 months of prevalent depression. So determinants for depression, some of the ones that I will be touching on in this presentation are socioeconomic status, years in America, discrimination, and a culture of stress. The next determinant I'll be talking about is years in America, and also something that goes hand in hand with that is foreign born versus U.S. born. So in a study in understanding psychopathology among the adult and child Latino population from the United States and Puerto Rico, an epidemiologic perspective, it was found that this discrepancy in foreign-born and U.S.-born and rates of depression was called the immigrant paradox. The study consisted of 3,125 respondents in which household interviews were performed using the National Institute of Mental Health Diagnostic Interview Schedule. It was found that both The next determinant is discrimination. For the majority of immigrants, discrimination is not something they want to encounter. According to a study conducted by Lucas Torres, Mark Driscoll, and Maria Vole, discrimination or perceived discrimination has been linked with poor mental health. In the study, it was found that Latino participants report higher depressive symptoms the day after an experience of discrimination. The study found that the higher levels of discrimination are associated with higher levels of a culture of stress and psychological distress. As I mentioned earlier, I mentioned a culture of stress. In another study conducted by Mark Driscoll and Lucas Torres on a culture of stress and Latino depression, it was found that the culture of stress is stated as being stress that occurs or stems from the experience of adjusting to a new culture and environment. Navigating two cultures at once in a brand new environment is stressful and has been linked to higher and more severe depressive symptoms among immigrants. The study also found that a culture rate of stress was closely related to lower ages, less education, In a study of 469 participants, with 41% of those participants born outside of the U.S., the study used questionnaires that focus on acculturative stress, self-efficacy, active coping strategies, and the severity of depression symptoms. The result found that lower active coping mechanisms have been found to be linked with higher levels of acculturative stress and severe depression symptoms. It has been found that those who use a higher amount of active... So this is my web of causation. So as you see, I have discrimination, years in America, socioeconomic status, acculturative stress, and coping mechanisms. A couple things I added next to some of those was in years for America, foreign born versus born in the U.S., socioeconomic status, access to healthcare, job statuses, access to different benefits that native borns have access to. Acculturative stress kind of encompasses several factors. So English proficiency, education level, those are stressors that a lot of immigrants have to deal with when coming to America, navigating, how to pay a bill or being afraid of having to speak English. And then coping mechanisms, there's a difference between the active versus the passive coping mechanism. So for the social work perspective, I chose kind of a cultural competent perspective. As social workers handling clients of a variety of different backgrounds, it is imperative to not only be culturally competent, but also to stay up to date on new findings. With the Latino population, the increase of acculturative stress, not only does more research need to be done, but we also need to take into account these different determinants and how we could use these to reinforce therapy. Additionally, social workers can work with the Latino population in advocating for low-cost resources, better access to mental and physical health care, and information on community services and education. Many times it is found that besides the lack of access to health care resources, Latinos prefer to go to family and friends to discuss their problems. This could be due to several cultural ideals and beliefs, and it's up to the professionals to determine how to better increase health checkups for the Latino population, as well as the greater immigrant population. For my community-based response, I chose SEPTA. I use this as a great referral oftentimes at the Latin America Association where I intern at. So SEPTA is a nonprofit bilingual and bicultural behavioral mental health organization that caters and addresses the needs of the Latino population in Georgia. SEPTA aims to provide services to address behavioral health issues for Spanish-speaking and bilingual consumers. Some of the components that SEPTA provides is a variety of different health services that are available to the community. SEPTA is the only licensed and accredited Latino behavioral health facility in the state of Georgia. Services usually begin with an initial visit followed by an assessment. From the assessment, you go to admission, treatment planning, and treatment and discharge. After discharge, clients are still monitored and they are also given referrals if needed. Some of the services that they provide is individual counseling, group counseling, supportive counseling, group education, family programs, nursing services / physical assessments, medication management, substance abuse prevention program, a community education program, and the Latino Youth Clubhouse. All these services are provided in bilingual or Spanish by educated professionals. So in conclusion, depression is a serious mental health illness that can affect people from 9 years old and up. Hispanics and non-Hispanics have about the same rates of depression, but it is apparent that depending on how many years you've lived in America or whether you were born in America can affect the rates of depression. Determinants for depression in the Latino population include socioeconomic status, years in America, acculturative stress, coping mechanisms, and discrimination. There is plenty of room for more cohesive research as well as bilingual and culturally competent medical professionals in the area. While I did my presentation on the Latino population, it is important to note that this affects immigrants as well as descendants of immigrants. We should make the effort to become culturally competent and be ready to handle these new clients. This has been my presentation on Latinos and depression. I hope you enjoyed it, and here are my references.